Hello everyone, welcome to the online medical imaging class. I'm Dr. Lin from the Radiology Department, second affiliating hospital of Santo University Medical College. In this session, I'm going to talk about fractures and dislocations, which are frequent presentations to the emergency department. What is a fracture? It is a medical term for a broken bone. It can be described as a disruption of the continuity of all or part of the cortex of a bone. Fractures can be caused by trauma or pathological changes of the bone. They occur when the physical force exerted on the bone is stronger than the bone itself. If the cortex is broken through and through, it is called a complete fracture. If only a part of the cortex is broken, it is called an incomplete fracture. How do we differentiate between joint dislocation and subluxation? If two bones that originally formed the joint are no longer in a position to each other, it is called dislocation. If they are partially contact with each other, we call it subluxation. Clinical features of fracture and dislocation include history of trauma, swelling, pain, deformity, ecchymosis, and dysfunction. Radiological features of fractures can be characterized by fracture lines, a bloody discontinuity of the cortex, and the jagged and rough edges of the broken end. How are fractures described? We can interpret them in many ways, including the number of the fracture fragments, direction of the fracture line, relationship of the fragments to each other, and whether there is communication with the outside. According to the number of the fracture fragment, fractures can be classified into simple fracture and comminuted fracture. If the fracture produces two fragments, it is called a simple fracture. If the fracture produces more than two fragments, it is called a comminuted fracture. By the direction of the fracture line, fractures can be described as transverse, oblique, and spiral fracture, like the diagram shown here. When the fracture line is perpendicular to the long axis of the bone, it is called a transverse fracture. When the blade is at an angle through the bone, it is an oblique fracture. Spiral fractures are usually caused by twisting or choke injuries. According to the relationship of one fracture fragment to another, fractures can be classified into displacement, angulation, shortening, distraction, and rotation. Displacement describes the amount by which the distal fragment is offset front to back and side to side from the proximal fragment. Angulation refers to the angle in degrees between the proximal part and the distal fragment, which is deviated from its normal position. Shortening is the overlap of the two ends of the fracture fragments. The term that is opposite to shortening is distraction. The distance between the broken ends of the fragments are separated from each other. Rotation describes the orientation of the joint at one end of the fractured bone relative to the orientation of the joint at the other end of the fractured bone. Now let's start to identify some common dislocations and fractures. The image on your left is a normal shoulder joint, and the right one shows shoulder dislocation, more accurately termed a glenohumeral joint dislocation, which involves separation of the humeral head from the glenoid of the scapula at the glenohumeral joint. Elbow dislocation is the second most common largest joint dislocation in adults and the most common in children. The left imaging is the normal joint. The lateral and epiview plane film on your right shows posterior dislocation of the elbow. This is a patient with hip joint dislocation. The head of the right femur and the acetabulum is no longer in opposition to each other. The one on the right shows a loosened band traversing the width of the scaphoid, red arrow, representing a fracture. You can compare this with the normal rix on the left. Look at the lateral and AP views of the right tibial and fibula. They reveal mildly displaced spiral fractures of both bones, red arrows. Here, we have a green stick fracture of the distal radius, involving only one part but not the entire cortex. Buckling of the cortex is seen on the PA view on your right, representing compression of the cortex. Green stick fracture is an example of incomplete fractures, which tend to occur in bones that are softer than normal, such as those in children. Distal radius fractures are common injuries, which refers to fractures within 3 cm of the distal articular surface of the radius. 3 types of fractures need to be addressed here. They are Colles fracture, Smith fracture, and Barton fracture. What is a Colles fracture? It is a fracture of the distal radius with dorsal angulation of the distal fragment. It is caused by a fall on the outstretched hand, sometimes abbreviated as FOOSH. There is frequently an associated fracture of the ulnar styloid. This is an X-ray of a 30-year-old man with wrist pain after a fall. The PA and lateral views demonstrate an impacted fracture of the distal radius, red arrow, with dorsal angulation of the distal fragment. Besides, the ulnar styloid process is not intact, and loosened lines in the third and fourth proximal phalanges can also be seen, black arrows. Because of the dorsal angulation of the distal fracture fragment, we sometimes liken a Colles fracture to a dinophore deformity. Smith's fracture is also called the reverse Colles fracture. It is a fracture of the distal radius with the palmar angulation of the distal fragment, which is caused by a fall on the back of the flexed wrist. Look at this typical Smith fracture of the distal radius, red arrow, with palmar angulation of the distal fragment. Barton fracture refers to the fracture of the distal radius involving the articular surface and subluxation of the radial part of the wrist after falling on an outstretched hand. Its diagram depicted the oblique fracture line extending into the radial carpal joint. The lateral view on your right shows a comminuted fracture of the palmar ring of the distal radius. Montigial fracture refers to proximal ulnar fracture together with the radial head dislocation. You can see this very clearly on your right. Galeazzi fracture refers to the distal one-third fracture of the radius, associated with dislocation of the lower radial ulnar joint. This Galeazzi fracture results in shortening of the distal radial fracture, red arrows, along with dislocation of the distal radial ulnar joint, red circle. Pathological fracture is usually caused by a condition that weakens the bone. In this patient with metastatic renal cell carcinoma to the humerus, there is a geographic lytic lesion seen in the distal humerus, red arrows, through which a transverse fracture occurs, white arrow. X-ray will usually be sufficient for the diagnosis of skeletal injuries, but up to 20% of subtle fractures are mixed on conventional radiographs. In this case, CT and MRI are often required to assess the presence of the subtle fractures and their secondary injuries. Let's look at these 3 images from the patient with blowout fracture of L3. The left one is the lateral view of the lumbar vertebral on the plane radiograph, It shows a wedge or compression fracture of the L3 vertebral body, red arrow. The middle one is the axial CT image, revealing a comminution of the anterior-posterior margin of the L3 vertebral, red arrow, and the posterior vertebral body wall is also not intact, red arrow. Besides, a fracture line at the junction of the laminar and spinal process on the left can be seen, red arrow. The image on your right is the sagittal fat suppressed titulated MR image. We can see that the posterior fragment is displaced into the spinal canal, causing stenosis. Here are the take-home messages. I hope you are now able to recognize the radiography findings for these following fractures: Colles fracture, Smith fracture, Barton fracture, Montague fracture, Galeazzi fracture, and green stick fracture. That's all for this session, and these are useful learning resources for you. Thank you for your attention.